Can you tell me about yourself?
My name is Sita Sharma. I'm a registered nurse from Nepal with 5 years of experience across general ward, emergency, and ICU. I completed my Bachelor of Nursing in 2018 and joined a tertiary hospital where I learned to manage high patient loads, multidisciplinary teamwork, and strict infection control standards. I'm confident with vital assessments, medication administration, wound and post-operative care, and I'm comfortable with common equipment like infusion pumps, defibrillators, and bedside monitors. Colleagues describe me as calm, organized, and compassionate. I enjoy teaching patients and families in clear, simple language and using TeachBack to confirm understanding. I'm seeking an international role to grow clinically, follow evidence-based practice, and contribute to a team that values safety, respect, and continuous improvement.
Why did you choose nursing?
I chose nursing because it balances science and compassion. I grew up watching relatives receive kind care during difficult times, and I wanted to offer the same dignity to others. Nursing gives me a hands-on role in recovery, from stabilizing a patient in the ER to celebrating their discharge. The profession also encourages lifelong learning, protocols and best practices change, and I enjoy keeping my skills current. Most importantly, nursing allows me to advocate for patients when they cannot speak for themselves.
What are your main duties and responsibilities as a nurse?
My core duties include assessment, planning, implementation, and evaluation of care. I perform head-to-toe assessments, monitor vital signs, interpret changes, and escalate concerns promptly. I administer medications safely, checking the 5 rights plus allergies and expiry, assist with procedures, and maintain accurate documentation in the EMR. I educate patients on medication use, diet, mobility, and follow-up, and coordinate with doctors, physiotherapists, lab radiology, and social workers. I also uphold infection prevention, maintain a safe environment, and support quality initiatives like pressure injury and fall prevention bundles.
Describe a time you handled a difficult patient.
In one situation, I was caring for a post-operative patient who was in severe pain but refused to take his prescribed medications and was shouting. My task was to de-escalate the situation, ensure safety, and still manage his pain effectively. I stayed calm, introduced myself, and took time to actively listen to his concerns. He was afraid of the side effects of the pain medication, so I validated his feelings and explained the purpose and possible side effects in simple, clear language. I also used the TeachBack method to ensure he understood. At the same time, I offered alternatives such as repositioning and applying a cold pack, and I reassured him that his comfort was a priority. I then coordinated with the doctor to adjust his analgesia plan and monitored his pain closely, reassessing every 30 minutes. As a result, the patient agreed to the revised plan, his pain score went down from 8/10 to 3/10, and his cooperation improved significantly. We avoided a potential incident and, most importantly, built trust by respecting his concerns while still achieving pain control.
How do you check and interpret vital signs?
I first confirm the patient's identity, wash my hands, and let the patient rest for a few minutes. Then I check the vital signs, temperature, pulse, respiration, blood pressure, oxygen level, and pain, the 6th vital sign. While checking, I look at the pulse rate, rhythm, and strength, the breathing rate and effort, and use the right cuff size for blood pressure. I compare the results with the patient's usual readings, look for changes or patterns, and think about the overall condition, for example, fever with fast heart rate or low oxygen with breathing difficulty. If I see any warning signs, oxygen below 92%, blood pressure very low or very high, heart rate too slow or too fast, breathing too slow or too fast, or sudden high fever, I report it immediately as per protocol.
What steps do you take in a medical emergency?
I follow the APSIDE approach: airway, breathing, circulation, disability, exposure, and call for help per code procedures. I ensure airway patency, supply oxygen, monitor with pulse oximetry, check circulation, pulses, capillary refill, 4-access, and assess neurological status. If the patient is unresponsive and not breathing normally, I begin CPR and use an AED defibrillator as indicated. I assign roles, use SPA to communicate, and document times, onset, interventions, drugs, shocks. I stay calm, clear, and task-focused, then debrief after to identify lessons learned.
How do you ensure patient confidentiality and privacy?
I only access or share information on a need-to-know basis and speak about cases away from public areas. I keep screens locked, verify recipients before sending reports, and avoid using personal devices for patient data. During bedside care, I close curtains, doors, and ask for consent before exposing any body part. If family asks for details, I confirm the patient's consent next of kin status before sharing.
How do you manage stress in a busy hospital?
I prioritize using acuity and safety risk, make a quick task list, and cluster care to reduce interruptions. I practice closed-loop communication to avoid errors, and I ask for help early when workload spikes. Short micro breaks for hydration and breathing help me stay effective. After difficult events, I use debriefing and peer support. Outside work, I focus on sleep, nutrition, and light exercise so I can arrive grounded and ready.
Tell me about a time you worked effectively in a team.
In the emergency department, we received a patient with multiple traumatic injuries. My primary task was to help stabilize the patient and prepare for urgent imaging. I immediately took responsibility for airway and oxygenation, secured 2 large bore 4 lines, drew blood for labs, and coordinated fluid resuscitation, while another nurse set up monitoring equipment. Throughout the process, I provided structured SPA updates to the physician and documented interventions in real time. As a result, the patient was stabilized within 15 minutes and transferred safely to CT, then on to the ICU without delays. The team lead highlighted our effective role allocation and clear communication, which ensured smooth and efficient patient care in a critical situation.
How do you prevent infection in hospital settings?
I follow standard and transmission-based precautions, hand hygiene at the 5 moments, appropriate PPE, aseptic technique for invasive procedures, and proper waste and sharps disposal. I screen for isolation needs, contact droplet airborne, disinfect high-touch surfaces, and ensure invasive lines are assessed daily for removal. I educate patients and families about hand hygiene, cough etiquette, and wound care. I also monitor for early signs of device-related infections and escalate promptly.
How do you handle a disagreement with a colleague?
I address it privately and respectfully, focusing on the issue, not the person. I listen to understand their perspective, state mine clearly, and seek a patient-first solution. If needed, I involve a charge nurse for mediation. I document any clinical decisions and ensure care remains safe and uninterrupted. Conflicts resolved early often strengthen teamwork.
What do you do if you make a mistake?
I put patient safety first, assess the patient, inform the supervisor physician, and follow the corrective protocol, example monitoring, antidote, incident report. I disclose honestly per hospital policy, focusing on facts and next steps. I review the root cause, workload, unclear label, look-alike sound-alike meds, and suggest system improvements, labels, double checks. A just culture approach helps everyone learn and prevents recurrence.
How do you educate patients and families?
I assess their language, literacy, and concerns, then explain using simple words, visuals, and demonstrations. I cover what the condition is, why the treatment matters, how to take meds, warning signs, and follow up. I use TeachBack to confirm understanding and provide written instructions. For language barriers, I request an interpreter rather than relying on family for critical details.
How do you prioritize when you have many patients?
I use triage thinking, first airway breathing circulation risks, then patients with unstable vitals, severe pain, new neuro changes, or time-critical meds. Next, I handle tasks that prevent harm, example fall risk, pressure relief, then routine care. I reprioritize throughout the shift as conditions change and communicate with the team if new risks arise.
Describe the proper way to give injections.
I verify the order and 5 rights, check allergies expiry, wash hands, and prepare in a clean area. For IM, I select the site, example deltoid, vastus lateralis, ventrogluteal, cleanse, use the correct needle length angle, 90 degrees, and consider Z-track for irritants. For SC, I choose abdomen arm thigh, pinch tissue, and inject at 45-90 degree depending on needle length. I don't recap needles, I dispose in sharps immediately, document dose site response, and observe for adverse reactions.
How do you handle families during critical situations?
I acknowledge their fear, give clear, honest updates without jargon, and explain what the team is doing now and what to expect next. I maintain privacy and consent, invite questions, and offer small choices, example who should be present, to give a sense of control. If emotions rise, I remain calm and empathetic, and I involve the physician or counselor when appropriate.
What is your experience with EMR and documentation?
I chart in real time using structured templates and free text where needed. I document assessments, interventions, responses, education, care plans, and communications with physicians' family. I use standard abbreviations, timestamps, and ensure entries are objective and factual. I'm comfortable pulling lab trends, medication MARs, and creating handover notes that follow SPA.
How do you uphold professional ethics in nursing?
I respect autonomy, informed consent, practice beneficence, do good, non-maleficence, do no harm, and justice, fair care. I maintain confidentiality, avoid conflicts of interest, and advocate when care plans don't align with patient wishes or safety. If I face an ethical dilemma, I discuss with the team and ethics resources, focusing on patient values and legal policy.
What is your approach to postoperative care?
I start with APACU handover, procedure, anesthesia, blood loss, drains, complications. I monitor airway, breathing, circulation, pain level, vitals, urine output, and wound drains. I prevent complications with early mobilization, DVT prophylaxis as ordered, incentive spirometry, and strict asepsis for dressings. I manage pain with both medications and non-drug measures and educate on deep breathing, splinting, diet progression, and signs of infection.
How do you prevent pressure injuries?
I assess risk using a validated scale, example Braden, reposition at least every 2 hours, and protect bony prominences with pillows and special mattresses. I keep skin clean and dry, manage moisture, ensure adequate nutrition hydration, and check devices, oxygen tubing, catheters, for pressure points. I document skin checks and escalate early redness or non-blanching areas to the team.
How do you ensure safe medication administration?
I follow the 5 rights plus right reason, right documentation, right response, and check for allergies. For high alert meds, example insulin, anticoagulants, I use double checks. I beware look-alike sound-alike drugs, calculate weight-based doses carefully, and confirm 4 rates on pumps. I educate the patient about purpose and side effects, monitor for reactions, and document immediately.
How do you assess and manage pain?
I use a numeric or FACES scale, ask location, character, duration, and factors that relieve worsen pain. I combine pharmacologic, per protocol, with non-pharmacologic methods like repositioning, heat-cold, relaxation, or music. I reassess at appropriate intervals, especially after giving meds, and adjust the plan if pain remains uncontrolled. I also watch for side effects like sedation, constipation, or nausea and act early.
What do you do if you suspect sepsis?
I recognize red flags: fever or hypothermia, tachycardia, hypotension, altered mental status, low urine output, high RR, and suspected infection. I escalate immediately, draw blood cultures per protocol, check lactate, start broad-spectrum antibiotics as ordered, and ensure fluid resuscitation and oxygen. I monitor vitals, urine output, and reassess frequently, notifying the physician of any deterioration.
How do you work with patients from different cultures or languages?
I approach each patient with respect and curiosity, asking about preferences, diet, modesty, prayer times, and involving professional interpreters when language is a barrier. I avoid medical jargon, use visual aids, and confirm understanding with teachback. I ensure family involvement aligns with patient consent and hospital policy. Cultural sensitivity helps build trust and adherence.
Why should we hire you? What are your strengths and areas to grow?
You should hire me because I bring solid clinical skills, a calm approach under pressure, and a strong focus on safety and teamwork. I'm confident with assessments, emergency response, medication safety, wound and post-op care, and patient education. My strengths are clear communication, reliability, and empathy. I'm proactive about learning, whether new equipment, updated protocols, or language skills for better patient connection. An area I'm developing is advanced critical care certifications and deeper experience with specialized devices. I've already enrolled in courses to close that gap. I believe my attitude, ethics, and dedication will make me a dependable addition to your team.